So my name is Mary Akangbe. I'm a nurse specialist practitioner in minimally invasive surgery and robotics. And I've been in the NHS for 31 years. So I started in keyhole surgery, minimally invasive surgery, when only consultants can look through the lens. Then we had the 1 chip, 3 chip, then we had the integrated theaters, and then we move on to different kinds of robots, from camera holders to full, the Da Vinci. Now we have Google, we have, different kinds. So I've been through all of that, and I've had the privilege to work in the Center of Excellence down the road in Camberwell, and be part of organizing master classes, teaching training, which gave me the insight into the fact that we all do amazing things globally, but in silo. So what can we do to bring everything together? Especially because in our teaching and training, people come from all over the world. We do different modules, and then sometimes we go out to support them when they've been with us to learn. And we organize different symposium and upskilling as well. So I established Zenith Global Health. Before then, I've been part of Transforming Health in Africa. It's been 15 years now. And I work with industry to establish centers of excellence across Africa for teaching, training, or if they have new products, equipment. It gave me also insight into procurement chain in other parts of the world. Who's in charge, who's not in charge, how things don't match, how they are not fit for purpose, and how some of the things that are meant for good actually turns the places to dumping ground. So it equipped me as well when people now come to me to say, we have this device or innovative way of working, we want to go to this particular part of the world. I have, I'm equipped with the right questions to ask. So we work with, I think I'm going to start from the back. So the purpose is to bridge the global south, global north divide, and to bring healthcare professionals together from both sides, so that when we are coming from UK, US to Africa, for instance, or other LMIC, we know what they need. It's not like this is what you need. And then to educate and support so that they can identify what is relevant as well. So talking about age, actually my first slide said our youth, our future. And you might be wondering that we are talking about age, I'm talking about the youth. It's because for a long time, we focused on the youth, and rightly so, because all the legacy, everything that we're doing, we are hoping that one day, at some point in time, they'll step in. But the other side to that is that the youth these days, they play with AI and the metaverse. And the generational gap tells me that what we are developing right now, if we do not educate, if we do not change the mindset, if we do not invest, then it will not be useful for the population that we are targeting through education and awareness. Also,
Just use your
okay, yeah. So I was talking about the AI, the edge technology, and the metaverse, and I'll come to the ethical implication at some point, and it's being fit for purpose. Now, the generational gap, culture. We've spoken about culture a few times today. Once upon a time in Africa, it's a sign of affluence to be obese. If you're obese, if you have some kind of shape, then it means you have lots of money, you have servants, you have drivers, people can do literally everything for you, and you don't have to do it. But now things are changing. But what we need to do as well is to change the mindset. What do we do with the aging population? How do we support them? I've talked about education. Not just, a lot of people in LMS are educated to whatever level, surprisingly. But now that we are moving into AI and tech, what do we need to do to get them to that level? So that all the products, all the data interpretation, data is another thing. Data is not very good. There's improvement, but we could do more. And like I said, Wednesday was presenting, is a big challenge to innovation. Because if your data is not robust, if it's not fit for purpose, if it does not reflect what problem you want it to solve, then we are not talking about health equity, period. Then about mindset again is about home care and care home. Typically, in an African home, you wouldn't take your father or mother to a care home. You'll be seen as a prodigal child. In fact, they'll call you different names that you may not be able to sleep at night. so again, what does that mean? That means it's a financial burden on the children. Psychologically, if you're a woman, it's a problem in your marriage. So what is affecting this population is actually affecting the whole system, the whole family setup, and it could cause disruption. It could cause mental health problem, which we don't do very well with either, you know. And the other side is that older people, let me take dementia and Alzheimer's disease, for instance. Some years ago, they are seen as being witches or bewitched. So again, there comes education and mindset. But now, thankfully, we now have care homes actually in some parts, and we have people actually actively promoting looking after the older people and setting up programs for them. Because otherwise, instead of, for instance, if you have a parent that have dementia or Alzheimer's, you lock them up. You don't want people to know because it's a taboo. So now, how do you care for them? You love them, but how do you care for them? So again, that takes me to why, if we are devising anything, we need to have culture in mind. We have to change people's mindset. Thankfully, like I said, it's changing. But 20, 25 years ago, I use the word changing because, you know, it's gradually changing. It's not embraced, you know, everywhere. So when we talk about care home, we have to talk about access as well. How do these people access the care home? How do we make, I mean, this morning I saw some amazing technology and I sat there and I'm thinking, these things, you know, they are replicable. You know, you can actually use them. Although we have to think about finance, which will come to healthcare financing later, but there are some simple things that could be done, like the program that you have with New Mind, like, you know, the data collection that you're doing, and even the VR. Because one of the things, one of the things I work with is skills and simulation. And after COVID, when I came back, we devised a 360-degree camera recording so that medical students and nursing students, they can have an idea what goes on in theater, who does what, the process, what's expected of them before their clinical training. So I know that the VR process is really, it's not that expensive, but how do we get them to use it? Now, so that's about tech literacy. The economic impact of aging. It's a public health burden at the moment. For some of the reasons that I've mentioned, there's the issue of access and availability. Access to medication, access to healthcare professionals. We know all about brain drain. You can go to even some secondary hospitals, and you find maybe you're supposed to have like 50 doctors. You'll be lucky if you find 15. 100 nurses, you'll be lucky if you have 30. And these people, right, they still have to cater for the same number of patients that, you know, they used to cater for. Now, let's couple that with somebody who is frail. So they are looking after patients who are able, maybe they walked in or they were brought in. Now we're looking at patients with non-communicable diseases, usually presenting at the later stage for various reasons, which we don't even have time to go into. It's a public health burden. How do we address that? Again, I go back to mindset. From before we get to that stage, it's important to educate people on the implications of self-care, wellness. I spoke about obesity. And Africa, for instance, we are so blessed when it comes to agricultural produce. What is missing is the education on how to use the produce to prevent diseases. And then it goes back to the same situation where part of what we can do in public health is to invest in these grassroots solutions before we come to the burden of disease. Now, I talk about fit for purpose solution. For instance, a lot of the innovative procedures, the wearables, the VR, and AI generated treatment. We need to look at something. Which group of people are we targeting? Because most of these old people, they are not in the city. If they're in the city, they've come to live with their children. They're not in the city. So, and they need it the most. Especially when we talk about telemedicine, we have lots of people who are startup telemedicine, startup in our network is Zenith Global Health. And some people, from outside who wants to go to Africa as well. And some of the questions that I ask them is the geographical location. How do we take these things to them? How do they power them when there's no electricity? How does it work when there's no water? So before you were talking about looking at the problem before devising the solution, it's very important to make sure that whatever we produce or we make is fit for purpose. Sustainability as well is something that we focus on that, globally we don't do it very well, but we do it better in some parts than the other. Whatever product or whatever solution has to be sustainable. Because, and then I was saying this to them at the World Health Assembly meeting, that when we gather in a room like this, we all know what to do, how to do it, when to do it. But the people that we want to do it for, how much knowledge do they have? What is their perception? And what can we do to make sure that we now use the bottom-up approach to solve some of these public health issues? Because if we break it down, get it to them, get them to, get to address the root cause problems, then, the solution will be easier, it will be sustainable, it will be accessible and affordable. Very important. So we do workforce development and upskilling. I'm very hot on upskilling because I'm standing here right now because I had that opportunity. It wasn't handed to me on a plate, like Prof said. In my last year in university, I'm a product of UCL actually for my, and in my last year, I had to use my days off and annual leave to finish my specialist course because I was determined. I was told something like, what do you want a qualification that your manager doesn't want? I mean, I'm older now, but in those days, I just answered back without thinking and got myself into real trouble. So I'm passionate about upskilling, and we do this across Africa. We encourage leaders, we work with policy leaders, we encourage them to upskill, because if I didn't have the opportunity to first go back, train, to retrain, and then to train as a specialist nurse, and then to train as, in the robotic and minimally invasive surgery, I wouldn't have the insight to support some of my colleagues who I'm so happy when I see them now in different areas, how they are progressing. or to actually step out and say, you know what, we can do this outside. If he works here, he can work in other parts of the world as well. And we have partners in UAE as well. We have partners in different parts that we work with. It's important not only to have the number, but to upscale. Who's got what knowledge that we can transfer? Who's got what knowledge that we can use in other areas? So again, we are hot on partnership and collaboration. I said that before. We work with community organizations because, like Africa CDC, for instance, when we had a meeting with them, they told us something interesting. They said during COVID, they were looking for community organizations to sensitize the people, or to make them aware of the risk, the level of risk they are exposed to if they do not take the right steps to avoid the transmission of infection, and again for the vaccination. Right now, we are struggling with HPV the vaccination because the media usually is more powerful than the clinician. And I was so upset because the one that is causing problem right now is, how do I put this? It's not really an elite media platform. It's like a platform where people go and say, oh, he pushed me, she pushed me, and you understand what I'm trying to say? And they made this broadcast, and the whole nation, all the parents refused to give their children HPV. So now the race is on. All the government is coming out, clinicians are coming out, the oncologists are coming out, CSOs are coming out, to say, look, it's good. And then sensitizing some who's had it to say, look, my children's had it, it's okay, and things like that. That's why we tend to work with CSOs as well, to support them, to help them to know how to relate with these people. Because sometimes the population, they embrace the information from the people closest to them than from others who are coming in. So we work with them, empower them, and again, what we are trying to do is to get them into high-level discussions as well, because they know what they feel, they know what goes on, they know the problem. But sometimes, and that is where upskilling comes in, it's not because they don't know what to say, but they are thinking, oh my God, I'm going to this big meeting. The commissioner is there. This one is there. What am I going to say? So we support them as well to say, look, you can go there, you can observe in the first round, take your notes, come back, make your contributions. And we work with policymakers as well to say, look, you have to empower these people. You have to make them feel as part of it. And now there's goodwill, political goodwill, to embrace health. Up until now, health has not been a priority. It's not really up there where it should be, but now there's political goodwill. COVID did that one good thing, where everybody is now improving their, focusing on the SDGs and improving the budget to focus on health. We support institutions as well, especially with industry, like the Johnson & Johnson National State Surgical Center in Nairobi. I helped them with that. We started on top of a supermarket. It's a very interesting story for me. We started on top of a supermarket. Then the University of Nairobi gave them the space. Now they've got lands. Now doctors go there as well. So they do teaching, training, and then we do management, we do nurse training. And the good thing is, which is what we do at Zenith as well, when we go to any part of Africa, I'll come to that by the time I finish. The good thing is, like in Kenya, people can come from neighboring countries and access those courses and then go back and also give back. The other thing I love doing is creating champions. So if I go anywhere, I'll say to them, give me 3 people who, we embrace this, and they can have access to us, either doctors or therapists or whatever, so that even when we are left, because you cannot go to a place like a week or 2 and then, make it all happen. I'm part of the West African College of Surgeons, and when we go, sometimes in a week, we do like 300 surgical procedures. But it's up to the people there, the doctors, the nurses, to look after them, because we can only take X number of time away. So we work in institutions to establish centers of excellence like that. Public-private partnership. Universal health coverage is on everybody's lips. We have to do this by 2030 and do this by 2050. But it's apparent from all we are saying today, from what we are all seeing, from all our experiences, that governments cannot do it alone. It's a global problem, but much more so in LMIC. In Africa, where the government, policymakers, don't want to see healthcare as a failure, although it has failed. They know me, they'll say, if you don't want to hear the truth, don't go to her. It has failed. It has failed, but they don't want to see it as a failure. So they always say, we built 400 health centers, You go there, you find equipment and everything, but sometimes there was time we went to a certain place. The hospital has an helipad. The water was dripping to wash our hands. And then in the clinic, somebody called me and said, we are having problems with this. I went there, beautiful instruments, horoscopes linked to the screen that could cut the clinic time into like half. And they haven't used them because it was bought packed, no training, nothing. So I said, do you have electric kettle? They said yes. So I just put the 3-pin behind the screen, plug in the socket, and then we have our, horoscope. So we need that partnership, for when things are bought, to have enough funds to say, look, we don't want you to just buy this. We want the training. We want the post-purchase services. We want, everything to be in place, again, to foster sustainability, to ensure the accessibility, and also to look after our aging population. Because if all of these things are not in place, then, the statistics are grim at the moment, but we are hoping, because things are improving, that it will be better. Now, I want to close on a lighter note. And I say lighter note because, from my experience as well, I asked Stephen again a very difficult question about the diversity of their data. I was involved in the 100 kilo genomics in environment where I can confidently say 60% of the residents are Black ethnic minority. And before COVID, we had a healthy number. And I can count on my fingertips how many people came forward from the Black ethnic minority group. So I know it's a real problem. But I want to appeal to everyone here who's got one innovation or the other to make sure that there's no racial bias, especially now in AI. The ethical implication is really, really, really important. A colleague of mine recently went to the Femtech summit, and she was trying a wearable. She's a doctor. She's a female something. She has her own startup as well. She was trying out a wearable, and the wearable couldn't detect her blood pressure because of her skin color. Yeah. I mean, when things like that happen, it drives it home. And at a seminar for that matter, with lots of people and everything. So everybody, well, they put it on it's on LinkedIn. I can tell you where it is. Yeah. She phoned me and she said, oh, what happened? I said, look, we'll get there. We're not going to stop. We'll get there, And I think Health Innovation Kent, they have some processes in place to mitigate things like that. So I'm appealing to each and every one to tell somebody that it's important that we do what we can. I see Steve said it's in the US for that purpose, to make sure the data is diverse, and to do what we can to make sure that we address these issues. Thank you very much.